The province has reacted to the backlash that it has received from the public, mostly on social media, with those complaints being brought forward by some saying that these bikes are not suitable for the terrain of the province. But let's speak to the MEC for Health, Cindy Swagomba, about exactly what these bikes are meant for when the project started, because MEC, there's a confusion as to, are these bikes for COVID-19 to deal with the pandemic that the country is dealing with now? So if perhaps let's start to the idea behind the introduction of these bikes.
Thank you very much, Bosi. It is unfortunate that in the covering of the event itself, our own communications, my own MEO dropped the ball in terms of explaining the project. This is not a new project. This project was not about COVID. It is just that we saw an opportunity to change it to COVID, and that in COVID it can assist. This project is about bringing back the ethos of primary health care, which when I got to the department I found that we're lacking. So primary health care in its nature has got a bedrock of healthcare workers who are based in clinics, in villages, in townships, in locations. One of the issues that our own community health workers would always complain about is exactly being able to navigate when they are carrying whatever they're carrying, whether it is about medicines, tablets that they are delivering. Sometimes it is a bit rainy, sometimes the weather is not favoring them, and at the same time, in some areas they are not even able to negotiate. It then suggests that majority of people must come to the clinic to pick their things. But if you go back to the basics of primary health care is about prevention. It then suggests that your own community health workers with the nursing staff who they are doing primary health care must be able to go to the communities and ensure that primary health care is not about clinics, unfortunately. Make it a point that most people do not get sick. So basically, what would these scooters benefit would be where we are dealing with issues of immunization, that will take it to those people. When we are dealing with children, and as we know that kids go to the clinic, what we call bioweisha, and they are being monitored, those issues will be done. So when you look at the scooters itself as a concept, it's a concept I personally saw working in Rwanda. And I went on to actually investigate and check on it, and I found that even other countries in Africa are using it. They are using it, fortunately, in terrains that are very close to our terrains or the same, like the Eastern Cape. Remember, Eastern Cape have got challenges of roads network. And even if you would have roads, let's say tomorrow we have them, but do we have connecting roads? So those are the challenges. So the scooters are not about replacing ambulances, but the scooters are about going house to house, ensuring that in the communities, services are taken. You know, it is a pity, I don't know whether you'd have an interest to go to Xhosa. If you go to Xhosa, where I felt like crying when I saw how they're working, where you'd find a female community health worker who would move into this dangerous terrain of a forest, have to cross a river. But the very woman would drive herself, that thing that they call Ipenyane, and cross over the other side. And that side, there is no clinic. If you go to my policy speech, there is a clinic for that area, Xhosa. Yet, the Xhosa, this other side, does have a clinic. But it then actually proved that it is not possible that you would have a service in this area, where the area is divided by a thick bushy forest and a river. It is quite dangerous, and people are complaining. So in our policy speech now, you will see that there is a clinic envisaged for the other side of Xhosa. So when we give them these scooters, they will be based in that clinic, and equally the clinic this side will benefit the same.
And when we speak about bushy areas, MEC, and the bad road infrastructure, and in cases where it's raining and there's mud, will these bikes be able to to navigate those roads, especially when we're talking about uphill roads and bad weather services?
When we were debating as the department last year, when this debate started, it did not start this year. I hear people say it might not have been started this year and be ready for COVID. No, it's an issue we debated last year. It's an issue we started to say we are looking at. Of course, when we started, we were debating as to where can these be most appropriate. The history of our villages is that most people would carry people on wheelbarrows to start to just bring them to the road for an ambulance. An ambulance itself would not be able to access the area. That's another area that these scooters can actually assist. If you look at the other countries, they do carry even pregnant women because those scooters in their nature are 200cc, when I was informed in the briefing as to what they are capable of doing. Again, when you look at the scooter, you are carrying a full clinic. It then suggests that a community health worker in this project is going to be trained to drive the scooter and have a license. But the community health worker as a driver, together with a nurse on the side, they will be able to go to communities in their homes and render the much needed service in terms of primary health care. It is then that COVID came in, whilst we're already in the process of this.
And perhaps some might have missed it, MEC, in terms of when we're looking at those scooters, there's an area designated for the driver and then the patient. And when we look at community healthcare workers, mostly in rural areas, there are mostly women who are females who are of elderly age. Will they be trained? Do we train these women to drive the scooters? Who will be driving the scooters? Do they have two designated people who excluding the patient?
In the preparation for this, the chief of staff in the office led a meeting both with the internal and the service providers, because part of their package is to train people on the scooters up to getting a license. What they were telling me as a report from their meeting is that they are now identifying district municipalities, because our system is about districts. They were identifying district municipalities where the very people will be trained exactly in their areas, not in East London, but in their areas, and will be given the license from their areas. So when you look at that, and I'm coming to this issue of age, yes, we are aware that some of the home community health workers we have, some have perished, some have joined in, but we do have a sizable number of younger people. But that has a plan of engaging 150 community health workers, which are both youthful and have matric, so that we can start to actually take them on board, and those are the people we want to actually see to this. And remember, community health workers are trained on basic things that they do in terms of health when they get to those homes.
So will we be having two people, the driver and the community health care worker, in cases where we're talking about these old women who are community health workers, or we'll be training more younger people? Then what happens to these more of old age community health workers that are already there on the system?
Let's separate the two issues.
Yes.
In any work situation, you would have people that perform a particular level of a job. You would also have others that perform. Remember, the same people assist in clinics in terms of queue marshalling, in terms of other issues. Of course, you would take those older ones who cannot get on scooters or not drive them or be trainable and make them work in the clinics. But on the basis of the 150 I've actually spoken about in terms of us getting to that level, we are sure, if you're talking metric, you're talking about age and everything else, you're going to get people who are trainable. So those, it is not always that a community health worker must travel with a nurse, because in some instances they're just delivering medicines. So, and in those instances they will go alone. But where it is necessary, like I'm saying, we're talking immunization, we'll have teams that get into the community. Obviously, nurses shall be part of that. And if you're talking immunization, you're not expecting to load a baby back on a scooter. So this chair that yesterday when we were showcasing the scooter was sitting on and driving in, that chair would obviously be about a nurse. But if you go at the back of that chair, you'll find that there's everything. There's a scale, there's whatever, there's stethoscope, there's everything. But at the back of the driver of that scooter, you saw that there's something like a hard body bag. That is about carrying medicines into the area.
And another issue, MEC, that has come very strong, the issue of costs.
Well, in terms of costs, I know there's a process that has followed. Let me maybe a bit get into what the report is about. At some stage, we had challenges because we could not find another person who does that. Remember, when we were actually inquiring as to where do they get them, they said in the Eastern Cape, in King Williamstown. We're shocked because it's just next door and we've never seen it. For instance, ever since I joined the department, I've never even had history that we had these scooters and what they were used for. But the excitement was made the best of it when in December, preparing for the festive season, those people were showcasing their scooters at the center where we are. We then discussed, having understood now, because even for those that were thinking it's a theory kind of thing, then they saw them. Then everybody was excited. But I know when they wanted to procure these scooters, Treasury stopped them to say, you cannot treat it as if this is a sole provider. Test the market. I'm told they tested the market, everything else was a bit delayed, and when ultimately the tender process was done, the very same King Williamstown was proved to be a sole provider of those scooters in those people that actually provided e-tender zabo and applied. So for that, I was given a figure that said those scooters are a little bit under 100,000 each or just above 100,000 each. And I was given a figure to say that would include a 3-year maintenance program. Even the training will be done by those people for those who are going to drive them. In the 3-year, then it suggests those scooters have a compartment that's giving you spare parts of the very same scooters, should anything happen when you are on your own. So the training is going to be a conclusive training that's going to talk about driving, talk about changing a tire, talking about whatever else that they have to do on the road. But the very company will be monitoring the maintenance of such for 3 years. And I was given a figure of 10.1 million.
And MEC, speaking of the processes and the procurement processes, were managers, operational managers within the department happy with the decision to have these scooters being part of robbing in and primary health? I'm asking this, MEC, because some of the sources that we spoke to are saying that the majority of managers within the department were not happy with this idea. And in fact, when some raised it, they are saying they were told they are delaying the process and getting in the way of actually acquiring these scooters.
It would be interesting, Lucy, to get such people, because this thing of always having anonymous sources, people who speak in the dark, and when you have a meeting of senior management, in that meeting, the whole senior management, including the heads of district services and the system, were in the meeting. And I find it strange, who signs documents, who procures? I don't procure. So how would I bulldoze a system that actually wants procurement? And I would, maybe the best person to speak about that would be the SG. But as far as I know, nobody. As such, when these scooters were launched, everybody was excited to say it's good that we're taking a number that would be seen as just pioneering and seeing how best we can use them. Maybe if it works well, we may extend it to other areas. I'm now shocked. I'm not sure, but we would be saying that, but it is quite interesting.
Lastly, perhaps MEC, the debate is around that the whole country now is focused on COVID-19 and trying to deal with the pandemic, and some are questioning why there would be monies that are being used for other things and not trying and curb and put funds together to deal with the scourge of COVID-19.
Let me put this in perspective. Health is not solely about COVID. There was a job and a service that must be delivered by the Department of Health, and that is enshrined in the Constitution. One of them is to save people's lives. And in saving people's lives, we've got services. If you look at the duty of what is happening there are people who are full in hospitals, and those people are not only COVID. So COVID came in as a disaster, whilst we still have to balance COVID together with the work that we're expected to do. So in a sense, us now wanting to push these scooters to actually assist in the COVID process is us realizing that COVID is not going to leave us tomorrow. But these scooters, instead of going only to what they were meant to do, they can double up and do the COVID work. The Eastern Cape has a challenge to actually deal with the tracing, following people, tracing contacts, and those scooters could well be very useful in that effect.
MEC, thank you so much for your time. Health MEC Cindy Swagomba saying that this is a project that was not only started now that the country is dealing with the pandemic, but they've been discussing the issue since last year, and this forms part of their health outreach programs, and that having these scooters now will help also in the fight against COVID-19, as they're trying to get a lot of people away from hospitals and getting health programs to the people, to communities, and actually deal, saying there that kill two birds with one stone. Of course, saying that the project cost about 10 million rand. We know that the cost that each scooter is 94,000 rand, with a 6,000 rands put for maintenance. They're explaining the whole issue. Of course, people continue to debate the motorbikes, if they are suitable for the terrain of the province. Some saying they are not, and some saying actually they are what the province needs. But it is happening. These are 100 scooters that have been procured by the province, not only to deal with COVID-19. In fact, the main idea was not to deal with COVID-19 at all, but to deal with other health issues. And now that it will be helping again with COVID-19 tracing and testing. We know that the province has a huge problem and backlog of tracing contacts and trying to get them in isolation and quarantine as soon as possible. We'll see how this will work. We'll definitely be going to those communities where the department is saying that these motorbikes are suitable, those communities that have bushy areas, that have bad road networks, to see if really these scooters are suitable and how then do they navigate into those. Of course, there's still the issue of licensing, because the people who will be driving these will need to have licenses. Of course, we are told that the company will be the one that will be training the 150 healthcare workers that will need to be on the ground to do the job.